Welcome, everyone. Thank you for joining us today. I'm Katie Sawyer. I am Senior Director of Donor and Community Engagement with the San Diego Foundation. And I'm delighted to be kicking off our Enabling Community Solutions learning series today with a discussion about such a critical and timely issue. This is the first of a series of 8 webinars, and the goals of this series are to gain a greater understanding of some of the most pressing issues in our community, to spotlight and learn from some of the leaders who are doing innovative, collaborative work to address challenges, and to share solutions, and particularly solutions that we can be a part of, either individually or as a part of the San Diego Foundation community. We really wanted to kick off this learning series now because, as we all know, community needs have been changing rapidly over the past year during the COVID crisis. And when we started to plan topics for this series, it quickly became clear that we needed to start with the conversation about hunger and food insecurity. So just a couple quick instructions before we kick off the discussion. I think we're probably all Zoom experts by now, but some may be less familiar with the format that we're in today. So for attendees, you won't have the ability to unmute yourself or turn your camera on, but we do want to know what questions you have, and we'll be sure to get them answered by our experts. So please enter any questions that you have in the chat. We'll save time for questions at the end, but you can type them in at any time. We'll either cover them as they come in or be sure to answer all the questions at the end of the program. And you can send the questions either to all panelists or to me directly, and we'll be sure to get your questions answered. And now, because we have a lot of content to cover, we'll dive straight into our conversation. I am so grateful to the experts who are joining us for this discussion, both for their time today and for the work that they do. Our discussion today will feature Anahid Brakke. Anahid has been president and CEO of the San Diego Hunger Coalition since 2015, with the goal of leading our hunger relief sector toward a data-driven approach. The Hunger Coalition facilitates 4 collaborative tables that bring together over 120 nonprofits. And those tables are the CalFresh Task Force, the Hunger Free Kids Task Force, the Hunger Advocacy Network, and the Hunger Free San Diego Advisory Board. We also have Catherine Slomka with us. Catherine is a registered dietitian and is Director of Nutrition Services at the Oceanside Unified School District, and she teaches nutrition at Miracosta College. She's passionate about food equity and particularly about making healthy food as accessible as possible. And as our San Diego Foundation in-house expert, we also have with us Pamela Payton. Pamela is Chief Impact and Partnerships Officer and Vice President of Community Impact. She oversees the San Diego Foundation's community impact programs, leading our strategic initiatives that advance quality of life for San Diegans. She plays a critical role in developing cross-sector partnerships, and importantly for our conversation today, she has led our COVID response efforts, which since March have included providing over $50 million in grants to over 200 nonprofit partners through the COVID-19 Community Response Fund. And I want to start there to kick off our conversation today. Pamela, food insecurity is a new area of funding for the San Diego Foundation. Could you speak just briefly to why the foundation shifted to a focus on food insecurity with the most recent round of grant funding through the Community Response Fund?
Well, thank you, Katie, and good afternoon, everyone. It's a great question. For 45 years, the San Diego Foundation has been working as an important resource for our community. And what we learned back in March was that one of the pervasive needs of the community was food security. There were a lot of people who lost jobs very quickly, of people who were underemployed already and were suddenly impacted by the pandemic. And so the San Diego Foundation decided early on that food security would be one of the areas that we needed to address, and we needed to address urgently. In the months since the COVID response or community response fund kicked off in March, we have granted about 50 grants at this point, 50 grants over $4 million in resources that have been pushed out into the community. And that is an area that we were not engaged previously. So what I learned and have learned at the foundation is that hunger is a hidden hardship the pandemic has made visible, a persistent crisis that the pandemic has made worse. It isn't as if it suddenly became an issue. It has been an issue for a very long time. And it, for us, is one that our attention has been devoted to for the last several months.
Thanks, Pamela. And Anahid, I would love to turn to you to speak a little bit to the big picture of what hunger and food insecurity looks like in our region. Could you share a little bit about what this issue looks like on an ongoing basis and how it's changed since the start of the COVID crisis?
Sure. Yeah, I'll just build off of what Pamela just stated so articulately. It has been a hidden crisis for some time. We've seen it slowly get better, but I think, and I know that people are always surprised. That's the thing, people are always so surprised to know how many people are struggling with food insecurity. And we've always thought about food insecurity and hunger being an issue of poverty, but we really have to change our mindset and think about it in terms of income level. It's insufficient income. Poverty is, the poverty level is so outdated, that measure. I mean, for a family of four, the poverty level is $24,000. I mean, that is extreme dire hardship. In San Diego County, we have about a third of our population earning less than 30 grand a year. In an area that's as expensive as ours, when you start to think about the economics and wages in our region, it makes a lot more sense how families are in a situation where they're really forced to make these difficult trade-offs, right? Rent is expensive here. You have to have a car for the most part to get to a job. All of these expenses are very fixed, and the one that's more elastic and the one that tends to suffer is food, right? Because we could spend a little less, we can buy cheap food that's high in calorie content, so our kids aren't hungry, but it tends to be so low in nutrition that we end up having these impacts of food insecurity, like children who are food insecure are 3 times more likely to be obese later in life. We're really starting to see, and it's been proven over and over, the impacts that we're seeing on the health side are being tied back to food insecurity. So we have, in general, the way that people cope is that they piece together a number of different types of food assistance. So it might be going to the food bank or a pantry at the end of the month. During the month, heavy reliance on school meals, the free and reduced price meal program, on CalFresh, which is California's name for food stamps, or the Supplemental Nutrition Assistance Program, or SNAP as it's known at the federal level. So I can go on a little more, or maybe I'll just stop there.
Yeah, and in a few minutes, we'll dive into the demographics and different sources of hunger relief a little more deeply. And Catherine, I would love to hear from you about what this looks like for your students and families in your district. What does hunger and food insecurity look like for those folks, and how has it changed in the past year?
Well, up here in Oceanside, our school district, we are about 65% of our student population is free and reduced. So we usually have quite a high need in our district, but with the change, with COVID, we have seen a shift in a lot of our schools that have a high paid population, have now very high participation of parents utilizing free meals during this time. One area in particular that we've seen a huge impact is we have 3 schools on Camp Pendleton. So our military families have been really impacted by this. In the beginning of COVID, we couldn't keep enough food in our kitchens to feed the families that were in need. I think we did our highest week in April was we did 75,000 meals in 1 week in just our district. And we were just blown away at the need. And we were happy to be there to be a part of that need being met. But yeah, it's out there. The need is very high, and as we're in our current predicament in our district, we're 100% virtual. So there's no hybrid learning happening. So we've been trying to get creative with how we can reach students and families in this time. And every time we expand our program, we see the need being met. We see our numbers go higher and higher. So when we expand to this community park, we see 100 students show up. When we expand to this bus stop, we see 50 students show up. So everywhere we go, we find need. So we're trying to be as creative as possible right now, given our circumstances, to expand across Oceanside. But yeah, we've been really surprised of how the need has been so steady, and how we've seen it have some peaks as well.
And you mentioned military families using the program more than previously. Are those not families who would normally be utilizing the free and reduced lunch programs?
Yes and no. We don't have high participation during a normal school year because families, when they're applying for free or reduced lunch, military families have to note their housing allowance as part of their income. And so that really skews their meal application. So based off of income alone, they would qualify for our program, but because they have to acknowledge their housing allowance, it disqualifies them from receiving a free or reduced price meal. So I think that that's a huge reason why, since we're able to serve all students for free, regardless of their status, currently, that we're making meal access that much more accessible.
Thanks for sharing that, Catherine. Military is such an important part of the San Diego community. Mm-hmm. And now we want to dig a little bit more into who it is that's affected by food insecurity and how the pandemic has changed that. So Anahid, I will turn back to you if it's okay to dig a little bit into the demographics of hunger in our region. And
sure. One thing I'll say,
actually, we have a spot poll that we wanted to pull up. We'll be doing a couple questions throughout this webinar to get a sense of where we are in terms of our understanding of the issue. So the first question that we'll ask is, how many people do you think were affected by hunger in San Diego County before the start of the pandemic? And I'll pause for just a moment to give folks a second to consider and respond. Okay, let's pull up the response and then, so we had about almost 40% of us thinking 1 in 4, 1 in 7, could be 1 in 12. Anahid, I will turn to you for the answer and then a little more detail.
I have a slide actually that I would love to have pulled up while I respond to that. And I will say that most of you were right because when it comes to the measure, actually, let me just take a super quick, just before I get into that, I just want to add one quick thing to what Catherine was saying about military families. It may be confusing to hear that military families suddenly had a spike in need. because it hasn't affected maybe people who are enlisted or, currently serving, but the military spouses who are working in our community are often working in part-time jobs, hourly jobs. And, that's the population of industries, right, that have been the hardest hit by COVID. And so that's why we're seeing some, need cropping up in military families. So there's I'm going to try to keep this as clear as possible. We sort of distinguish between self-reported food insecurity and our total estimates of need. So in 2017 is the last year for which we have survey data. It's California survey data, self-reported food insecurity, and that self-reported food insecurity rate was 1 in 7. The reason that I differentiate between need and self-reported food insecurity is that people tend to underreport their food insecurity. Parents are afraid if they say that they're not able to provide enough food for their kids, that their kids will be taken away from them. People are ashamed. And when we shift from a self-reported to also looking at economic indicators of food insecurity, like income level, that's where we can start to get our arms around really like everybody what is the total population of need. So in 2017, 2018, the total population of need, and that includes people who are experiencing hunger, at risk of hunger, or maybe getting their needs met because they're currently on food stamps or getting, or like their kids are getting, 10 to 15 meals a week at their school district. Those are all food assistance programs that are helping to meet the need. But as the Hunger Coalition and our partners are trying to understand like the whole vulnerable population, it was 1 in 4 before COVID. So who is this population? Well, 50% of people who are struggling are living with a disability. The second bullet is especially surprising, right? That more than half of food insecure people are working, 43% full-time. But I already kind of gave you the spoiler on that, which is that basically these are low-wage jobs, less than $30,000 a year. And so it starts to make more sense when you think about like trying to make ends meet at those lower income levels in such an expensive region. A third of the population are kids under age 18. More than half are Latino, but nearly 30% are white, 7% are Asian, 5% Black. That's just, an older, but based on self-reported. And then half of our public school students are eligible for free and reduced price meals. The cutoff for free and reduced price meals is an income of about $46,000 for a family of 4. So when Catherine says that 2/3 or so of her families were eligible for free and reduced price meals before the pandemic, that is very, very low income. So I'll stop there. And then the next slide, we can talk about what it's looking like right now. So starting in January, and now we're talking about total population in need. So in January, about 1 in 4, and then suddenly, right, massive job loss all at once. We know that families don't have savings. If you remember the economic shutdown and all that conversation about how federal workers were living paycheck to paycheck and didn't have savings to weather like even a month of not having income, and what a crisis that was. Now we've had so many months of no income, very little savings. People are going into debt. People are months and months behind on their rent. So now that we've dropped down a little bit to more of like a 1 in 3 risk, I think we just need to prepare ourselves for this being a long-term problem. Certainly through the end of 2021, we're going to see elevated food insecurity risks. But right now we're at about 1 in 3. And so then we use those numbers well, I'll stop there. So 1 in 3 people overall, 2 in 5 kids, about 1 in 3 seniors. If you would, oh, perfect. So looking at where food insecurity is distributed across the county, for the first year, this is the first time that we have been able to do this type of analysis to really look at where these numbers are distributed countywide. So, you know, I think people maybe expect to see food insecurity down at the border, but maybe are a little more surprised to see such a high level of food insecurity in the El Cajon area. That's the area under Lakeside. And then coming up through the center of the county, the north, you know, the North County kind of inland corridor, all the way up into Fallbrook, and then coming out to Oceanside. This is an area that has been in need, that is experiencing higher levels of need than we've seen before. Yeah, I'll stop there.
And that map does really highlight the importance of Catherine's work in Oceanside, seeing that dark green there and even patches of dark green in Camp Pendleton. We had a question come in that I think this is the perfect timing for as we're talking about food insecurity. Catherine, the question that came in was about military families in Camp Pendleton. Hearing that military families are needing to utilize the program this year. Does the military take any responsibility for food insecurity, or are we just relying on local organizations to step up? Catherine, we'll turn to you, and then Anahid, if you have anything to add on that question too.
Sure. I think this might be a better question for Anahid, but I'm not sure. I know that there are resources for military families that are struggling, but in my experience, and it's only been anecdotal, I have not done any personal research, which is why I think Anahid would be better. But when I speak to military families, or when I get phone calls from parents, they're overwhelmed. And so I think I would hope that there are resources for them, but they don't it's not necessarily as easy to receive, and they don't know where to go. And we're very much in the spotlight, literally on the curbside. And they know us, we're safe, we're a safe place, that they've been really thankful to be able to know that they can come to us twice a week. We'll always be there between this time and this time. And we're a reliable source that they can trust for food for their kids.
Anahid, what could you share about programs specifically serving military families and what the military provides?
This is a very touchy issue for the government and for the military, for the Department of Defense. And they are not very open about it, and they don't like it. And they don't like it when hunger advocates push hard to make it something, you know, to bring it forward. So instead of, we need to be hammering on the government to pay military more money. Instead, I think what keeps happening is people want to exclude the housing allowance from the calculation of need, and try to make military families eligible for SNAP. I would argue that you know, I already paid my taxes to the military to pay workers. And now my taxes for SNAP and food stamps are also being used for military. I'd much rather see them reappropriate some of that budget to pay lower level you know, officers. So it's a tough one, and Mazon and some of these other national organizations have really been fighting with the government to try to, you know, but excluding the housing allowance so that military families can be on SNAP is a Band-Aid. I'm all for Band-Aids in the short term to make sure that kids have enough to eat and aren't falling behind at school and all of that. But we need to be looking at what we're paying our military members, maybe pull a little bit back from some of the contractors and have it support our own military men and women. One thing that is so great about serving universal free meals at school is that it pulls in those military families, and it also pulls in the families who also earn just a little too much to qualify for free and reduced price meals. And so that's something that Catherine has done in her district, is moved towards universal free meals so that those military kids during normal times can also eat for free.
And that is something that I want to be sure to highlight, because Anahid, you mentioned the income limit for qualifying typically for free and reduced lunch, but Catherine, that income limit is not in place right now during the current crisis. Is that right?
That's right. And the only thing I'd like to add that I think is important for understanding why we have higher need at this time particularly, a lot of it has to do with income, and that is also very much tied to the burden of virtual learning. So because parents have all 4 kids at home now, let's say mom or dad is deployed, mom can't go to her job anymore. She has to be home with all 4 kids. So we're seeing parents call that say that they can't work anymore because they have to be home to monitor their children. So that's another reason why the need is also increasing, because parents either have lost their jobs due to COVID or have to actually have quit their jobs because of COVID.
Katie, and I can quickly add that among the grantees of the COVID Community Response Fund grants have been a couple of organizations that are serving the military, including Armed Services YMCA and USO. And what I have heard in talking to USO in particular is exactly what we've already heard from Catherine and Anahid, and that is that in many cases, the military family member who was working full-time to help supplement the family's income isn't able to do that now. And so meanwhile, the needs in the home have increased, but money for diapers, money for food isn't as available as it was prior to the pandemic. And so the grants that we've been able to offer to both those organizations have been able to help families supplement, what is already a pretty low income for a lot of our enlisted families who, perhaps those in the audience listening today, may know someone who is enlisted and know that their salaries are very low. As you join in the senior ranks, or if you are an officer, of course, this doesn't apply. But for many of our enlisted who we depend on every day to defend our country, their incomes are generally pretty low.
Thanks, Pam. And we'll be sure to share out afterwards the list to all of our attendees, the list of all of the organizations that have received funding through the Community Response Fund, which is a robust list of some fantastic organizations. Mm-hmm. We've touched on this a little bit, and I want to dig into where meals come from. So when we talk about hunger relief, what is the big picture of sources of hunger relief, and how are families and kiddos getting fed? I believe we have another spot poll right now. And the question that we're asking folks is, what is the greatest source of hunger relief in San Diego? Is it CalFresh, which refers to food stamps, school and youth meals, or food distribution? And we'll pause just a moment. And then when we have a good handful of responses in, our comms folks, if you could bring up the responses. Okay, so it looks like we're thinking CalFresh and school and youth meals. Anahid, would you share with us a little bit about what are the primary sources of food and hunger relief in our region?
Sure, and I think you guys have could you guys bring up the slide with the pie charts? So again, a very educated donor audience. I'm very impressed. Yeah, the biggest one is CalFresh food stamps. And then the next biggest piece of the pie is the school and youth meals. And then after that, we've got food distribution. We've got another program, the Women, Infant and Children's program known as WIC. And then that little blue slice is senior meals. So when you start to, I think a couple of years ago was the first time that we created a pie chart like this. And we do this by going to all of our partner agencies, both of the food banks we work closely with, pulling the information from California Department of Education on the school and youth meals, pulling the information from the Department of Social Services at the state level for the CalFresh, and also our local county. So this is a very collaborative effort behind this data. People are usually very surprised to find that 90% of hunger relief food in San Diego County comes from federal nutrition programs, and only about 10% is supported by philanthropy. I think that has changed a bit this year. We've seen that food distribution has really grown. I'll say that the size of the two circles is meant to basically be indicative of the total number of meals provided. So you see as a community how much we've grown during the pandemic, in large part thanks to philanthropy, but also because we passed giving people the maximum amount on their CalFresh card, their food stamps card. That has been a huge help. And some other USDA waivers have made it just easier than ever for families to apply. And there's still so much more opportunity there within CalFresh. And just to give you a sense of the impact of CalFresh, right now a family of 4 can get $680 a month. So and then when we look at the opportunity with school meals, those school meals is a program that's already funded. The food's already, there's already money for that food set aside. And so when the pandemic hit and nutrition service directors like Catherine and the people who lead the other school districts' nutrition services suddenly had to take their cafeteria-based meal services out to the curb. And so while the money for food is there in the government, the money for that transition, new carts and new refrigeration and cooler bags and warmers and all those kinds of things that to completely transition a meal service is holding back. We've been working on that, and that's been, I think Pamela's going to share a little bit about the San Diego Foundation's investment in helping schools transition so that that federally funded money can come. Mm-hmm. This chart is not about saying that one program is better than another. This chart is for us all to look at all the different types of assistance that are available, and then we can start to think about like making sure we're maximizing the utilization of every single one and not placing an undue burden on any of it. So we've got more room to grow with food stamps, enrolling more people. We're going to be pushing that really hard, and more room to grow on getting school meals to the families that need them. And then, the food banks have many of them have doubled what they've been doing, right? And so if they can maintain that, and we can increase CalFresh and we can increase school meals, we are going to close the meal gap.
And I think we have a slide illustrating where the meal gaps are in our county too.
So we take the total estimated need by zip code. We take all that information, which is also available by zip that was behind those pie charts. We also have a calculation for determining, how much food are people purchasing themselves. We know on average about 65% across the whole food insecure population, which is maybe, sorry, too much detail here, but the end result is that for the first time ever, our hunger relief community has a resource like this that can help us guide our resources. So right now, our community is doing a really good job of getting food down to South County, where we saw those really dark areas of need. But there's some areas up in North County that we also need to bring onto our radar. So we're working together with our partners. We're working with districts. We're trying to, advise philanthropic donors and foundations to support group, districts like Catherine's. And yeah, I'll stop there. Sorry.
Anahid, thank you for bringing these maps and this data. It is striking and highlights the importance of these programs, and including the work that districts do, like the work that Catherine does. We can close down the slide, please. And Catherine, just while we're talking about where meals come from, I want to turn back to you. You touched on this a little bit, but something that you said that really struck me as we were prepping for this was that as the need spiked at the start of the pandemic, the usage of school meal programs declined sharply. Can you speak to why that happened, the accessibility issues that people were facing, and the ways that you've expanded programming to reach families where they are?
Sure. So yes, as Katie said, we saw the need spike, and then the total amount of meals that we were serving was high, but the actual amount of children that we were reaching compared to our district size, so we're at about 16,000 students in our district, but we were only reaching maybe 1,000 to 3,000. So we were trying to figure out, why is this happening? And we realized a lot of it was the access. When a student comes to school, they have access to meals. We do breakfast, we do lunch, snack, and supper at our district. So they can choose to participate or not. But now when schools are closed, they actually had to leave their house to now come get food. And so this means that they have to rely on mom and dad to take them to school at this particular time to pick up meals. They have to walk to school if mom and dad are both working. And if neither of those are an option, then they're not receiving meals. So as we are reaching out to parents and principals who have more of an ear to the need of their students, we realized, we really have to expand just geographically where we are. So we decided to open all 22 of our school sites for curbside pickup. And that was our first step, because at first we were just doing half of our school sites, because as Anahid was sharing, the transition from kitchen to curbside was overwhelming. We needed a lot more hands on deck to prepare and package every single meal. You'll be surprised how long it takes to put cucumber slices in a baggie, and then put that in another bag, and then put that in a refrigerator. And all of that just created so much labor that we couldn't even feasibly have all 22 of our sites open. So that was our first step. And then we expanded to community parks. And then we started doing home deliveries. So when we partnered with our transportation department, who are used to busing, students, and so they're not able to do that anymore. So I called their director and I was like, hey, maybe we should collaborate. You used to bus scholars, but now you could bus food. So we worked with them, and then it took a bit of time. Like Anahid said, we needed the equipment, the cooling bags to make sure the food would be safe. And we started doing home deliveries for either kids that are in quarantine, or they can't come to the curbside or leave their houses, or there's just extenuating circumstances. We don't have that high of a special ed population, but making sure anybody in a special needs category who just getting them in the car in the first place is a huge task. So making sure that they have meals delivered. And just 2 weeks ago, we started doing bus stops as well. So we're now at 8 different bus stops around our city. And in the first week, our participation boosted about 300, which we were really surprised of, that 300 more students are now walking to the bus stop to pick up meals twice a week, which was exciting. And, you know, just putting on our creative hats and trying to figure out how we could solve this puzzle. But yes, as I've said, it's just, so now I'm always just thinking, okay, now where can we go? Now where can we go? And making sure that we also have constant communication with our state of, can we go here? Can we go there? Because now we are under all of these waivers that allow us to serve outside of our actual kitchen, whereas before, students were never allowed to take meals off of campus, let alone have parents pick it up unless it was a field trip. And that was a special circumstance. But now that we could serve at parks and bus stops, it's like, okay, let's get creative here because the need is definitely very high.
Oh, you're muted.
It's not a Zoom meeting if someone doesn't forget to unmute. I think that all really highlights, Catherine, the way that schools have become kind of a default social service agency for all of a family's needs. And I don't know that schools get enough credit for how flexible staff and administration are in making sure that student and family needs are met in a time of crisis, no matter what the crisis is. I want to turn now what we asked all of you and turn to some of our staff who works with donors to share was, what are some of the misconceptions that we hear about hunger and food insecurity? And wanted to give the three of our panelists a chance to respond. Catherine, I'll stick with you for a minute. The first misconception that we want to give you a chance to respond to is the misconception that school meal programs are a drain on our economy.
Yes, and this is one misconception. And I would say, I think it's the opposite. I think it's an investment. And because during a normal school year, we actually work quite closely with local businesses, whether that be local farmers, restaurants, bakeries. We have a pretty high pull in terms of product. So when we make an order, it's a big one. So we have a couple school gardens, and in a non-COVID world, we grow produce, we sell it to local restaurants, and the kids get really excited that, you know, their produce is on a plate of a very expensive restaurant that they grew. And then sometimes we have those chefs come to our schools and they show the kids how to cook, make asparagus taste really yummy. And then right now with COVID, we've gotten a little more creative with working with businesses that are close to shutting down of, okay, so you've got pizza dough, we've got cheese and sauce, so let's work together and you can give us a discount on the food. And so we worked with a local bakery just Christmas time when we did a big distribution right before Christmas break, and we did that exact thing. They made the dough and then we gave them the sauce and the cheese, and they made these beautiful, healthy take and bake pizzas that the families could take home, and they sealed them, put the directions of baking in English and Spanish. It worked out really beautifully, and they got to you know, bring back some of their employees that haven't had work in a lot of months to be able to fulfill our order. So we love working with Oceanside companies, and we're trying to be more creative.
Oh, that's really fun. And Anahid, I would assume that the kind of fact of pumping dollars back into the economy, that would apply to kind of all federal nutrition programs, right? When you're talking about the hundreds of dollars in food stamps going to families, those are dollars that are spent at our local grocery stores.
You're so on the money with that, Katie. No pun intended, but yeah, that's school meal programs support local jobs and local food. CalFresh is spent at the grocery store, supporting local stores, supporting the local tax base, supporting our local economy. So yeah, these things, in addition to being hunger relief and you know, in addition to being the most equitable and cost-effective and broad sweeping types of hunger relief, they're economic stimulus programs.
And Anahid, another misconception that you hear in your work is when folks don't want to apply for food stamps themselves or support and assistance themselves because they're afraid of taking it from someone who might need it more.
You know, that's one that breaks my heart to hear. And I know that families are also thinking the same thing about school meals, and not realizing that the more families that come to pick up school meals, the more money that's going to come in and support that school meal program and keep it healthy and going. And but yeah, a lot of people think that, especially the elderly, think that about the CalFresh. And we're only utilizing about 60% of what's available. And if we don't pull that money down from the federal government that we already provided with our taxes, then you know it doesn't come back to San Diego. So we're working to combat that misconception among people who are in need.
We'll dig a little bit more into those programs in just a minute. Another misconception, Pamela, that I wanted to give you a chance to respond to is directly from folks who care about our community, who want to be part of change. When we hear these shocking statistics and the scale of the challenges, people might think that there's not much that they can do to help overcome challenges like hunger, food insecurity, food waste. How would you respond to that?
You know, there are so many things that people can do. Naturally, the first, when I was a kid, if you wanted to help with a fundraiser or some sort of activity to help address food insecurity, you brought a can of something in your pantry. You know, certainly that is still appreciated in most instances, but there's so much more that people can do beyond contributing financially. And obviously, the $4 million that I spoke of earlier that the San Diego Foundation has distributed in the last 10 months to 50 or so different nonprofits is only because of the generosity of donors who have contributed to the COVID Community Response Fund. And that for that we are very grateful, and we encourage people to continue to contribute because we are working directly with Anahid and others to really understand where the greatest needs are and trying to be very deliberate in distributing those resources where the need is the greatest. But beyond that, there is a lot of work that you can do as an anti-hunger advocate, and advocacy and policy development is part of that. Someone asked a question earlier in the chat about advocating on behalf of the military, and certainly that is one segment of the population that's very important, but really hunger needs to be recognized as a priority for the entire nation, and addressing hunger needs to be acknowledged by the entire nation and by our government. So, we really encourage people to support programs and policies that will reduce the number of people who suffer from hunger and food insecurity. Anahid has several that she is working on, but there are so many ways that a person who cares about this issue can be a part of our coalition of anti-hunger advocates. We need you all, whether it's your advocacy, whether it's showing up when there are food pantry needs. The San Diego Food Bank has said, COVID-19 has even affected them in terms of their volunteers. A lot of people are afraid to come out and volunteer right now because of the potential risk. And so volunteering is important, but certainly when we think about long-term programmatic and policy changes that can really begin to shift and make a difference in this, it's going to take supporting advocacy efforts and changing policies.
Thank you, Pam. And that segues us perfectly into the next thing I want to touch on. When we're talking about effective ways to combat hunger in our community, Anahid, I know one of the things that you're a strong advocate for is supporting programs that help us leverage federal dollars. Could you share a little bit about what those programs look like and why it is such an effective use of philanthropic investment?
Sure. And I'll just share something about myself, which is that I worked in philanthropy for 10 years. You know, I used to work on the grant making side. In fact, I was an employee, a proud employee of the San Diego Foundation for 5 years. So this, I understand the importance of wanting to make a sustainable investment, wanting to leverage other funds toward the issue with your charitable investment, um, and wanting to push the envelope, right? And so the opportunity that investing in school meals or other types of federal nutrition programs, that opportunity, like, you know, okay, in addition to leveraging millions and millions of available dollars and getting those meals flowing into our community and bringing that money back locally to be spent here, charitable dollars invested in making government programs work better that's the innovation frontier, right? Because when we make things work here locally by helping a school district to try something new, then we can point to that and say, look how it works. Now we've been working, for example, we worked on breakfast in the classroom for a long time. And then we used charitable dollars to do that, right? Charitable dollars to help schools adopt breakfast in the classroom. And then we could say, hey, state legislature, we need more money. We need government money to do breakfast expansion. And so we have a breakfast expansion grant program for the state now that our nutrition service directors can apply to. So, you know, there's a lot of innovation that we can do with our government programs. I think sometimes people, listen, we need both, right? We need food right this second. We need to squeeze everything we can out of the federal nutrition programs today. And then we need to be working with our leaders and advocating to make them work better and make them easier. In San Diego County, the average time on CalFresh is less than 2 years. You know, this is a hand up. This is a temporary lift to families when they fall on hard times. So let's make that work better so that as soon as somebody falls on a hard time, we're giving them that lift immediately. And then did you want to maybe show that, I think that last slide that just is a different way of looking at the different, what has happened over the pandemic and the different levels of meals that come from different programs. And so you see with the advocacy to increase the CalFresh benefits during COVID, and also make it easier for people to apply, no interviews right now. It just spiked, right? So many more meals coming from CalFresh, that's the green line. The purple line dropping, that's the school meals. So when the school meals, when the schools dropped and they had to when schools closed, you know, and they're adapting to this hybrid model, we had such a dip. Thankfully, between donors and our food banks and pantries and all the organizations that distribute food being able to, like, I don't even know how they did it, to like double what they were doing almost, you know, that helped offset the loss of school meals. But it really, you know, there's room to grow in the CalFresh and the school meals arena, and in the food distribution area. We got to keep supporting that and have that fill the gaps that we can't reach through CalFresh and school meals.
Anahid, thank you. I think it's so interesting and important to understand how these different sources of food and hunger relief fit together. Thank you for sharing that. We'll bring the slide back down, please. And Catherine, something I want to make sure to give you a chance to respond to, because you work for a school district, which folks might not think of as something that they could individually support, although through the Community Response Fund, we certainly have provided a lot of support to school districts over the past 9 months. Catherine, how can folks, donors and funders, support your work and the families that you serve?
Where do I start? No, we have a lot of need, as Anahid was alluding to, it's above and beyond. Serving food to the community is so far above just making a meal and handing it out. And so with COVID and us needing to be able to take food out of the kitchen to families, one of our greatest needs is for storage, refrigeration, refrigerated trucks, or I was sharing with Anahid earlier that one of my dreams is to have this gorgeous food truck that would be just as exciting, if not more exciting than the ice cream truck when it comes in the neighborhood, and the kid would recognize it. It would have our school logo on it, and we could serve food directly from a food truck. And I just think that would be awesome. But being a government-run program, every dollar that we get, whether it be federal or state, has strings attached to it. We have things that we can and cannot spend our money on. And so for things above and beyond, our hands are really tied, and food costs have gone up since COVID. Labor is still pretty high. So if and when someone would want to donate to a program like nutrition services in schools, one thing to note that is really important is to make sure that it's very specific where you want your funds to go, because we are part of a school district, but we are not tied financially to the general fund of the school district. So any funds that are intended for nutrition services need to specify they're for nutrition services. And not only does this ensure that your funds would go where you intend them to go, but they would also increase the rate at which we could use those funds. As Anahid was saying, we need things fixed and we need them pretty rapidly. And when it's not clear where funds are intended, it can take up to a year to get those funds released to us to be able to actually use them.
Kevin, thanks for sharing that. I think it is so important for donors and funders to know how to make sure that their investments are being used exactly as they intended. And Pamela, before we close out, I just wanted to give you a chance to share a little bit more about what you're excited about, proud of, that the Community Response Fund, in collaboration with so many of the donors who are on this call, have been able to, what we've been able to do in response to food insecurity.
Thank you, Katie. And I just want to thank Anahid and Catherine as well for everything that you're doing every day. Clearly, you're both incredibly passionate and just love the communities that you're serving, and we're grateful that you are doing, leading these efforts and doing what you're doing. We could not do what we do at the San Diego Foundation as it relates to food insecurity without you. And so for that, we are very, very grateful. Food insecurity, as I mentioned early on, is not an area that the San Diego Foundation had been invested in previously. It is entirely because of the pandemic that we find ourselves in this place. The fact that the community has contributed $65 million to the San Diego Foundation in the last 10 months speaks to just how committed the community is and addressing, the needs. They don't know where to invest the money either, where to make a difference, but they have trusted the San Diego Foundation to identify the needs, to identify the partners, and that is what we have done over the last 10 months. And so it has been extraordinary. It has been a learning experience for us, but we could not do it without, as I said, without partners like Anahid in particular, and the San Diego Hunger Coalition, which has really led so much of what it is that we've been able to do. And, Catherine, I want to speak to something that you talked about, and that is the need for some storage, for supplies, for additional manpower that you did not need previously, but that these unusual circumstances have brought you to a place where you want to continue to provide food for our kids. And we know they need it because so many of them are not able to be fed at home and really rely entirely on the school districts to support them for their meals. And so our resources have gone to provide everything from direct support of food pantries to helping organizations like the school districts purchase the supplies that are needed to safely store food and to be able to distribute food. And in some cases, there are a couple of examples where they've purchased trucks to help distribute the food, because now we have the food, but how do we get the food to the people who need it most? And when we think about who is most impacted by the pandemic as it relates to food insecurity, let's not forget audiences or communities like our seniors who in the past have been able to get up and go to the community center for their meal, but they can't do that because the community centers are closed. And so many of our community partners have created programs where they're going and doing food delivery. And so we're supporting those efforts as well. And then, groups like restaurant workers, a lot of the funding that we have distributed has gone to some really innovative, amazing programs where restaurant workers who are currently unemployed or underemployed because their restaurants have closed are part of an ecosystem that are doing everything from fishing to collect fresh protein, bringing the protein to inside, preparing the meat, and serving the meat to other restaurant workers and to others in the community as well. So we've been just amazed at the level of creativity and innovation and commitment by so many in the nonprofit community to addressing these needs in the way that they know best how to do. And the partnership has just been phenomenal. So we're grateful, most certainly to our donors who have made all of this possible, but truly without the support and the leadership that we've received from our community partners, there would not be the level of engagement and the amount of support that we've been able to contribute. So I want to just once again say thank you very, very much for what you are doing.
Thank you, Pam. I would echo the thank you to our panelists and to those on the call who have supported this work either in partnership with the foundation through the Community Response Fund or through your own generosity and volunteerism. We like it. We are at time, so I want to wrap us up. We always like to close when we have a group of caring community members with a couple words about things that you can do to help. So if we could pull up our call to action slide with a handful of things that folks can do. And we will share, my commitment is that we will share more information about all of these ways to get involved. So please keep an eye on your inbox. Of course, you can donate to the San Diego COVID-19 Community Response Fund. We'll share the link with you. We'll also share the list of nonprofit partners that we have funded because they're fantastic organizations doing critically important work. If you'd like to learn more, we had a couple of questions come in right at time. If you'd like to talk more about this issue, ways that you can support and be involved, please connect with us. You can always reach out to me directly, connect with our staff and local experts to learn more about food insecurity and hunger in the region. Again, I mentioned this is the first of a series of 8 webinars, which will focus, each of them will focus on a critical and timely community issue. The next one coming up toward the end of February will focus on generational wealth for Black San Diegans and our newly launched Black Community Investment Fund. Take the time to learn more about local organizations doing work in this arena. The San Diego Hunger Coalition provides a lot of great information and education on this area, including their State of Hunger event, and we will be sharing the link for that. And we will also share this webinar recording and more information about ways to get involved and the other sessions in our learning series. So again, thank you to Anahid, Catherine, and Pamela for being so generous with your time and expertise and for the important work that you do. And to everyone, thank you for joining us to learn more about this critical issue and for the work that you do to support our community. I am so grateful to be a part of the San Diego Foundation community and to work together in support of folks across our region. Thank you for joining us today.
Thank you.
Thank you so much for your leadership, San Diego Foundation. Thank you.
Thank you.